A nurse named Tessa Vale had worked 12-hour shifts for so many years that she could tell the time by the ache in her shoulders. On a cold November evening in Duluth, Minnesota, she was halfway through a double shift in the emergency room when a visitor in the waiting area muttered something that stuck with her. "She is just a nurse," he said while arguing about a delayed room assignment. Tessa heard it. She always heard things like that. She didn't respond. She simply checked another chart, adjusted her ponytail, and kept moving. If you believe in kindness and second chances, please like, comment, share, and subscribe to Kindness Corner. The ear was crowded that night. A snowstorm had rolled across Lake Superior, covering roads with slush and ice. Ambulances kept arriving. The coffee in the staff lounge had been burned for hours. Everyone was tired. Tessa was especially tired. Her father had recently moved into assisted, living after a stroke. Her younger brother kept calling to discuss bills they couldn't quite afford. Her old car had started making a rattling sound whenever she drove over 30 miles an hour. And despite 20 years in nursing, she still found herself explaining to strangers that nurses did more than fetch blankets and take temperatures. She rarely talked about her frustrations. She just worked. That evening, a middle-aged man sat alone near the back corner of the waiting room. He looked homeless at first glance. His beard was uneven. His jacket was worn thin. He hadn't checked in. For nearly 2 hours he sat there quietly. Around midnight, Tessa noticed him swaying slightly in his chair. Most people walked past him. Tessa didn't. She approached and knelt beside him. "Sir, are you okay?" The man tried to answer, but stumbled over his words. Years of experience made something click in her mind. She immediately called for a wheelchair. The man wasn't drunk. He wasn't sleeping. He was having a stroke. Within minutes, Tessa had him inside an exam room where doctors confirmed what she suspected. Because she acted quickly, treatment began before permanent damage could set in. The man survived. The next morning, after a sleepless night, Tessa barely remembered his name. Marcus Harlan, just another patient she'd helped. At least that is what she thought. 3 weeks later, the air was busy again when the automatic doors opened, and 6 men entered wearing civilian clothes. Their posture immediately stood out. They moved with purpose. The receptionist looked nervous. One of the men approached the desk. "We need to speak with Nurse Tessa Vale." People glanced up from magazines and phones. The receptionist blinked. "May I ask what this is regarding?" The man exchanged a look with the others. "We're looking for Raven-6. Nobody understood what he meant. The receptionist certainly didn't. When Tessa eventually walked into the FIS lobby carrying a patient file, she froze. One of the visitors immediately smiled. "There she is." Tessa looked confused. "I think you've got the wrong person." The tallest man shook his head. "No, ma'am. We've been looking for you." The ER staff slowly gathered nearby. One nurse whispered, "What is happening?" "Watin, Wanti Bay." The tall man introduced himself as Garrett Boone, a retired Special Forces operator. Then he explained, Marcus Harlan, the patient Tessa had treated weeks earlier, wasn't homeless at all. He was a former combat medic who had served alongside several members of an elite military unit years before. His life had unraveled after losing his wife and struggling through depression. Pride kept him from asking for help. He drifted from place to place, gradually disappearing from the lives of people who cared about him. His former teammates had searched for him for nearly 2 years. They had almost given up. Then one of them received a call from a hospital social worker. Marcus was alive. The stroke Tessa caught early had not only saved his health, but had made it possible for people to find him again before he vanished completely. Tessa listened quietly. The men weren't there to celebrate a military hero. They were there to thank a nurse. Garrett laughed softly when he saw her uncomfortable expression. "Marcus told us something," he said. "He said everybody walked past him except one person." Tessa looked down. To her, it had never felt extraordinary. She had simply noticed someone who needed help. The Special Forces veterans spent only a few minutes there. They shook her hand, thanked her, and prepared to leave. Before walking out, Garrett paused. "By the way," he said, "Raven-6 was Marcus's old call sign. He insisted we come find the nurse who refused to ignore him." Then they were gone. The waiting room slowly returned to normal. Monitors beeped, phones rang. Patients arrived. Life moved on, but something small had changed. A few days later, Marcus returned to the hospital. He was healthier, cleaner, and walking steadily. His former teammates had helped him reconnect with family and secure housing. He brought Tessa a handwritten note. Nothing expensive, no grand reward, just a note. Inside he had written that when people stop seeing you, you begin to feel invisible. The night she stopped and asked if he was okay was the first time in years he felt seen. Tessa folded the note and kept it in her locker. On difficult days, she still reads it. Common kindness still exists, if you believe even one good act can change someone's life. If this story touched your heart, please leave a like and share it with someone who still believes kindness matters. People often measure importance by titles, uniforms, or status. But sometimes, the person who changes a life is simply the one who notices another human being when everyone else is too busy to look. And often, kindness begins with something as ordinary as stopping, asking a question, and caring enough to wait for the answer.